Welcome to Pediatric Grand Rounds in the month of the military child. This morning, I have the pleasure of introducing Dr. Matt Studer, who comes to us as a pediatric cardiologist in the Heart Center in our Division of Cardiology here at Seattle Children's and University of Washington, and he's also a member of the Regional Cardiology Consult Service. And prior to joining Seattle Children's and UW, he served over 21 years on active duty in the U.S. Army. He retired in October 2020. As an Army pediatrician, he served in multiple locations in various clinical and administrative capacities, but primarily cared for military-connected children. His last assignment was at Madigan Army Medical Center in Tacoma as the Chief of Pediatrics and the Regional Director of the Puget Sound Military Medical Consortium for Pediatrics. Thank you so much for being here, Dr. Studer, and take it away. Thanks, everybody.
Thank you, Dr. Mazur. Thank you to the Grand Round staff. And thank you to the greater audience for joining me this morning. It's a real privilege that I've had over my career of over 21 years in the Army on active duty service to care for these kids as an Army pediatrician. I retired, as Dr. Mazur mentioned, in October of 2020, where I served as a pediatrician, as a cardiologist, and a leader within the military health system. I'm also a product of the military experience. So I grew up as an Army brat, as sometimes we refer to children of active duty service members. And so I grew up in the military healthcare system. And so between my life as a child and my professional career, wanted to take the opportunity today to share with you some unique aspects of these military connected kids. I have no disclosures here, and the views that I do express in this presentation are those of my own and don't necessarily reflect official policy or position of the Department of Defense or the U.S. government. So April is the month of the military child. It is an opportunity for us to celebrate their service, their sacrifice, and the importance of their military connectedness. These kids are citizens of the Army, of the Air Force, of the Navy, of the Marines, and of the Coast Guard. And they represent a rich and diverse tapestry of the United States, from ages of 0 all the way up to young adults. And they deserve our collective attention and awareness as healthcare providers. And that's what we'd like to spend some time today discussing. So the objectives of my talk today is to identify those unique lifestyles of our military-connected children and their families, and the potential impact on their medical and social well-being, to advocate for and support these children and families through a better understanding of available resources, both within the military network as well as online, and then talk about collaboration and the importance of partnership with regional military, Department of Defense healthcare providers in the context and the spirit of joining forces to collectively improve the healthcare delivery, educational opportunities, and scope of services to these children. So I just want to take a moment and present you the 30,000-foot view of the military health system. There are an enormous number of beneficiaries, both active duty service members, families, retirees, that benefit from this far-reaching health system. And I draw your attention to a few things here in this slide. First of all, family members of active duty service members number almost 2 million. And of that, over 1.2 million children are part of an active duty family. There's another over 4 million to 4 to 5 million retirees. And in those, there's approximately 4 million kids that have had a family member, a parent who have served in the military. The military health system, just to give you some context as well, there's almost 120,000 births per year. That would rank, if the MHS was a state, would rank number 9 in the country, and it's about 40,000 more deliveries than the state of Missouri. There are an enormous number of hospitals and large medical centers, and within this health system, a large number of active duty service members and pediatricians. We train pediatricians, we train subspecialists in pediatrics, and there's been a very large commitment to the health and well-being of these kids. But we can't do it alone, and that's an important part of why we're talking today. So what is a military-connected child? Well, as I alluded to, we estimate 1.7 million children of active duty service members as well as those kids in the National Guard and Reserves. Over 40% of those kids are less than 5 years old. And then there's an additional 4 million military connected children, including those of post 9/11 veterans. And over 2 million kids have a parent who has served in Afghanistan or Iraq. And of those parents that have served, many have served multiple times. And so this is a large cohort of kids that have a very unique experience in their lives. And so let's talk a little bit about what that military child phenotype might look like. And this is somewhat of a generalization, but I think a number of these descriptors hold true. Kids are adaptable. They make friends easily. They tend to have authoritarian families. There is the ever-present risk of a parental death, both during deployments or in training. Combat arms, the profession of war has dangers associated with the training that goes into that as well. These kids are resilient, and they have a strong sense of community. And what's important is, I think, in the context of awareness, is to show you where these kids are located and these beneficiaries located. And they're located throughout the United States. And this slide here just shows you where those beneficiaries congregate. And this isn't just kids, it's beneficiaries and families of the military health system. But I draw your attention to the Northwest. Here in the Northwest, in the Puget Sound area, we have a very large congregation of service members and a large congregation of kids. I draw your attention to Alaska as well, where we have in Fairbanks and Anchorage, a large percentage of children there too that serve through a military connected parent. As we bore down a little bit more, I want to show you the scope of where these bases are located. So this is more of a world view of bases by location. And as we get closer to the United States, you can see quite the enormity of bases that span our country. And then here in the Northwest, in our WWAMI region, as I alluded to, a very large number of bases here in the Puget Sound, but we also have military bases in Spokane, Great Falls, Anchorage, Alaska, and here in Idaho. So these kids are around us, and we care for these children. And I just want to take a moment here to focus a little bit more attention on the Puget Sound area. There is a very, very, as we all know, a very large military presence with almost every service represented, to include the Navy with a carrier group, the Joint Base Lewis McChord, which has a corps, which is an enormous number of military personnel. We have Whidbey Island up north, where there is a Marine Corps presence and naval aviators. Not on this slide, but I'd be remiss to also mention here in the greater Seattle area, we have a large Coast Guard base. And so this military presence includes children. And we see those kids here in Seattle Children's. And I think it's important to know and recognize that. So just looking at a snapshot in the last 4 years of TRICARE reimbursed outpatient visits by location, we total almost 12,000 visits across a number of locations here in our greater WWAMI region. This excludes the U.S. Family Health Care Plan participants. And I'll just mention that there is a subset of military families that can opt into this insurance program that allows them to exclusively receive civilian health care. And so these kids are not included in these numbers, but those two are absolutely directly military connected children and are part of kids that we see. Broken down a little bit further by specialty, you can see here, this is just the top 20 specialty services within Seattle Children's that sees children. Cardiology happens to be far and away that which sees the most, but it from urgent care down to nephrology, seeing over 300 kids over this past 4 years, really 3 years, I think just speaks volumes to the number of children that we see and the issues that may not be readily apparent. And nor might we fully understand what unique aspects of their life may affect them medically. So briefly discussing the military culture. So the military culture is one that is quite unique, distinct, heterogeneous, but also has some overarching themes of an organizational structure, a very distinct hierarchy of the officer corps and the non-commissioned officer corps. But it is one that is ethnically and geographically very distinct. A third of active duty service members represent an ethnic majority. It is, in general, a very young service, a male majority. And though many join for different reasons, it really is one of a shared experience, generates a lot of camaraderie, discipline, self-sacrifice, and patriotism. And as you might expect, the military culture becomes the family culture and becomes the children's culture. Well, I think what's an important component of this military culture, two things that I'm going to highlight and then we'll continue to discuss throughout the course of the talk here, is the military experience of active duty service members in particular involves relocations and deployments. Relocations, traditionally we call these PCS, or primary change of stations, occurs every 2 to 3 years. It is the military philosophy of the importance of change, and it is often not near extended family. And so you lose that family support when families PCS on a regular basis. They also lose that connectedness that they've had in building the family around them and have to start anew on an almost every 2 to 3 year basis. And what's important to note too is sometimes those service members may have to move but unaccompanied, so they can't bring their family members with them. And a place where this classically is the case is in Korea. So there's a large presence of military personnel in South Korea, almost 35,000. A number of those people that serve there for 1 year of an unaccompanied tour, where the family member and their children often have to stay stateside. And then deployments. So deployments have been the mainstay of military culture over the last 2 decades. And that includes the global war on terror, wars in Afghanistan and Iraq. And I think what's important to note is that many military service members have had multiple deployments, 2, 3, 4, upwards of 10 in our special forces groups, who are constantly being asked to travel into combat zones, unsafe areas, to serve our nation's best interests, and that's often at the expense of their family members. So since 2001, as mentioned, 2001 and 2002, we have been in active wars in Afghanistan and Iraq. And these are the longest sustained deployments of service members and men and women in U.S. history. And this issue of deployments, relocations, these social determinants of health impact our kids. And I'll talk briefly about relocations, but I'm going to spend the majority of time when we talk about the science and the impact of deployments on the health of kids. It's really where we're going to spend most of our time over the duration of this talk. Let's touch momentarily on relocations. So for children, their experience, if they're moving every 2 to 3 years, is they may move between 6 and 9 times over the course of their kindergarten through high school experience. You might imagine how difficult that may be. Other surveys have seen kids at 8 different schools by the time they're 18. 90% of kids have lived abroad at some point in time in their lives. And this can obviously be a unique challenge for kids. It can be one that generates strength and resilience, and we'll talk about that, but also one that can be very difficult. And in the context of the medical community and medical continuity, kids lose that and are having to start anew with a new pediatrician, with a new host of subspecialists on a somewhat regular basis. And though complexity of disease at times can allow families to remain and homestead in one geographic location, that's not always the case. And just because a child has a complex medical condition does not protect that service member from having to move. And with that comes starting new, creating new bonds and trust with new healthcare providers, new healthcare systems within the civilian sector, as well as the military sector. That's extremely difficult. I think it's also important to remember and to give credit to the impact that it has on spouses. Spouses have limited and disrupted employment opportunities, make less than their age-matched peers, and that too can have far-reaching implications. In the context of deployments, as I mentioned, 2 million children have experienced a deployed parent since 2001. And that results in frequent separations from a parent or parents. Those deployments can be unpredictable and really can result in an aggregate stress, in particular if there's been an injury or a death of a parent. And though the operation and tempo of deployments has significantly declined over the last 5 to 7 years, where it was at its peak in the mid 2000s. It still is present. And I took this is an article clipping from just March of last month. The USS Nimitz returned after a 1-year deployment. This is in our backyard, and these are kids that we're taking care of. And so that unpredictability too, I think is important to highlight, is that the Nimitz was planning to return almost, I believe, on 3 separate occasions, but on each of those occasions when they were ready to return, were asked to do more service within a number of very dangerous areas. And so it is hard to predict sometimes. You can see how that creates an aggregate stress on the family. I'd be remiss to not mention some special considerations for our Reserve and National Guard service members. They can be suddenly military in the way that they serve, and they deploy, and they shouldered a large burden of deployments for both the wars in Afghanistan and Iraq. And unfortunately, though they remain near family support, they may not have the military installation support that active duty service members have. And at times may feel isolated, and their benefits are different than active duty service members, and yet they serve alongside active duty service members when deployed on a regular basis. And so, though I talk often throughout this conversation about active duty families, our reservists and our National Guard service members absolutely an important component in that conversation, as are their kids, and how they too can be affected by the service of their parents. So let's talk about war and deployment as a unique stressor in the military-connected child. Certainly, we historically think about fathers deploying, but remember, mothers deploy. We have circumstances where we have dual active duty service members that deploy at the same time, and though that is rare, that is a real risk. We have single active duty service members that have to deploy, and we have a number of parents that are parents of child with special healthcare needs, and that all of those circumstances and frequent prolonged separations from a loved one certainly create a unique stress for our child. In a combat environment, there's always ever-present risk of injury or death of a parent. That daily routine is very uncertain. And when a parent returns, they may not be the same person they once were. And unfortunately, this is a part of the military culture that is poorly understood by our non-military peers. As I mentioned, in 2007, when it's to the point of uncertainty, that was at the time of the Iraq War when there were over 150,000 service members deployed. And that was a point in time when President Bush decided that the surge was important, and they added an additional, I believe it was 20,000 troops in January 2007 to augment those 150,000 troops that were over there. The 82nd Airborne deployed 3,000 service members in less than a month. So not much time to prepare. And you can imagine that dizzying impact that it had on the families. The service members that were there too, that had an original deployment of 12 months, that got moved to 19 months. And you can imagine that too, and that impact on families. So we talk often about this concept of deployment cycle. And the deployment cycle is really a way to think and prepare about the process of deployment. And it involves 5 components, and it's that pre-deployment. And with these components come a host of emotional challenges, difficulties, stressors on the family. That pre-deployment period, and the timeline for these can be highly variable. It can be up to 6 months that a service member knows and anticipates that they have a deployment. And it can be a matter of literally days as well in the setting of some of our special forces service members. But during this pre-deployment period, there's a lot of anxiety, there's anticipation, and at times denial. During the actual deployment, there's a significant change in responsibilities, both for the spouse as well as for some of those older kids that now have to step into the role of a parent. People can feel overwhelmed and lonely, in particular during those early days to weeks of the deployment of the service member. Then we move into this period of sustainment, where for the most part, families create a new confidence in their routine, their independence, teenage children in that new role feel that sense of responsibility and accomplishment that can be very positive. And then we get to that pre-reunion, a period of time, about 30 days, when we anticipate the return of the active duty service member of excitement, apprehension, and anticipation of the return. And in this post-deployment, where we have a new renegotiation of roles, but it also can be a honeymoon period where things are fine on the surface, but can generate a lot of challenge and conflict and tension from a redisruption of a new norm within the family that can be very difficult. I'd like, if you take just a few things from this talk, it would be these three bullets as being, I think, probably some of the most important. So we know that at all ages, the well-being of the parent at home is strongly associated with the child's well-being during the deployment. And we know that's true too in other forms of stress that kids and families encounter unrelated to military service. That parent that's at home is a real cornerstone to the success or challenges of a deployment on kids. And within that parent, the parents that have intrinsic strengths or extrinsic support are parents of kids that do well. And that emotional availability of the spouse directly impacts the children's mental and physical health. I often say, and as someone who has deployed, that my deployment, and I think deployments for service members, is often harder on the spouse than it is on the service member, because of the weight of responsibility that spouse now has to shoulder is at times can be overwhelming, and is absolutely impacts the health of the child. The second thing that I'd like you to take home from this slide and this talk, that science and the study of deployments and its impact on kids identifies, is the cumulative length of deployment affects all children of all ages. And there's a host of studies, a few that I'll reference today, where we look at the duration of deployment, and the aggregate duration of deployments on kids can have a real profound impact. And though it can be different based on age, sex, and developmental stages, as you might imagine, it still is impactful. Then lastly, we certainly have seen a number of studies that have demonstrated a substantial rise in child maltreatment in young children in particular, and then suicidal ideation and suicide in our teenagers. So let's take a little walk down history lane here. In World War II, London had Operation Pied Piper. The Operation Pied Piper was the decision, aggregate decision, to send as many kids as possible out of London proper because of the bombings in World War II. And the London felt that those kids would be safer if they moved them to a countryside, separated them from their parents. And what was discovered was that even 60 years later, that separation impacted adversely those kids who reported as adults attachment issues and increased fearfulness, as I said, almost 60 years later. So the separation of a child from a parent, in particular during a wartime event, can be quite devastating. And parents see that. Parents reflect on that. In a few studies, one a survey of active duty spouses, another one from Dr. Flake, who's a good friend of mine and based down in Madigan, developmental pediatrician, looking at parents' experience. They felt that over a quarter of them felt their kids responded poorly to a parent's deployment. A third report academic problems in their school-aged kids. And of the parents surveyed, 42% reported high-risk stress in themselves. And you can imagine, to my original point, that can obviously impact on their ability to be emotionally present for their kids and meet their emotional needs and well-being of their children. And so, as you might imagine, a child's response to a deployed service member, deployed parent, is shaped by their developmental stage. So in our younger children, they may manifest as worsening stranger anxiety, a change in their tantrums or eating habits. As we move into our school-age kids, parents may see more mood changes, school-related issues, somatization of their stress. And in our teenage children, more volatility, anger, acting out, or conversely, more apathy, more reclusive behaviors, all as a product of a parent's departure from the family's routine. So let's talk a little bit about some of the studies that are out there. And I think what's important is that a few studies that I'm going to highlight are taken from large retrospective databases. And so the military health system actually has a very large, an enormously large database that includes information from both military healthcare as well as civilian healthcare that children have received. And this here, I think this study published in 2019 highlights the changes in behavioral health over the course of the two wars in Iran and Iraq. So between 2003 and 2015, using this MHS database, Gorman et al. Looked at diagnoses of psychiatric diagnoses in kids ages from young ages 2 to up to 18, and saw a significant percentage in rise of annual diagnosis from 9 to 15. They also noted a significant number of visits per child from 6 to 8 per year, and highlighted one of the more significant rises over the course of these years of suicide ideation in the subset of kids that they were able to look at. And I draw your attention to the number. There's over almost 1,800,000 children per year in this database from which they can pull from. And so they were able to look at a large aggregate of kids over time, military connected kids over time, and identified this rising trend in behavioral health challenges. Now, I think what's important is they note that this really is in line with what we're seeing in the civilian world. And what they also note is they didn't see spikes during periods of increased deployments, but use this as a way to demonstrate that our military connected kids are suffering to a greater degree mental health challenges, commiserate with their civilian partners. Let's talk a little bit about the Washington State Health Youth Study. So this was published in 2008. This is a biannual youth survey. And in fact, 1 in 5 participants have a parent or a guardian who serves on active duty. And a quarter of the kids that responded had a parent that had deployed during a combat zone. And what they looked at here in this subset in particular is kids reporting of low quality of life, having depressed mood, or thoughts of suicide. And what I want the take-home message from this slide is that clearly teen military boys are at increased risk for all three, in particular low quality of life, depressed mood, thoughts of suicide. If they have a deployed parent, that risk goes up. And that sadly, suicidal thoughts, when they have a parent that is deployed, it is notable across all grades for boys, and it also includes adolescent girls. This study speaks to the aggregate stress of deployments and their impact on the mental health of our kids. And I'll draw your attention. This was studied between 2003 and 2006. This table focuses on females, but it's very similar table with boys. That any mental health diagnosis went up when a child had a service member that was deployed, but it went up further when that deployment extended beyond 12 months. And it was an aggregate deployment, so recurrent deployments counted. Children had significant rises in any mental health disorder. They also had significant rises in acute stress reactions and adjustment disorders. And the authors conclude that they felt that as a result of deployments, there was an additional 6,500 mental health diagnoses attributed to that parent's deployment. As I mentioned, sadly, the rate of child maltreatment is higher when soldier parents were deployed. This study looked specifically at the experience of enlisted service members who have deployed, and noted that of the 1,800 corroborated maltreatment events, the overall rates were higher during time when the service member deployed as compared to when they were not deployed. And so it just again speaks to the stress that can be associated with the deployment and that's impact on the family member and ultimately on the child. This study looked at injury, so parents that have been injured, either as a product of war or a longer-term consequence of war. And I think this is a really fascinating study that highlights a few things. So they define injury either as a combat injured parent with a relatively low number, or a parent that had an injury that occurred not as a direct consequence, although the service members freely admit that many things like PTSD and traumatic brain injuries, though may have occurred or as a consequence of a deployment, may not be directly attributed to a combat experience. But nevertheless, an injury in a active duty or a military parent absolutely translates to an impact on a child's health and well-being. And I'll draw your attention here to the right in this slide, that non-combat injuries are the blue circles, combat are orange circles, and regardless of the mechanism of injury, injured parents had 20% less preventative care following the injury. So they compared pre-injury to 2 years post-injury. And in the non-combat injury, there was more injuries in children that required emergency room visits. There was a much higher incidence of maltreatment post-injury, of needing mental health care, as well as prescribing psychiatric medications. Now, one of the positives of this study that the authors reference is that it would appear that a direct combat injured parent, though maybe not seeking as much preventative care for their child post-injury or upon their return, and there's a host of reasons why that may be the case, that they did not see an increase in maltreatments or mental health care or injury in those kids. But they fully recognize that a product of combat, of deployment that may go unseen initially, so PTSD, TBI, clearly has an impact on those kids following that event. I think this is a really nice, large, albeit retrospective, but large assessment of the impact of injury on the health and well-being of kids. I'd like to take a moment and talk about COVID and its impact on children. We have little data to date on the effects of COVID-19 on military households. But there was a troubling survey in December of 2020 hosted by the Blue Star family. They surveyed almost 700 active duty spouses and service members, majority were spouses, regarding their perceptions about the COVID-19 vaccine. And a third said that they'd received the vaccine. And almost 60% said they would not allow their child to receive the vaccine. 25% were undecided. They cited vaccine development and safety concerns as two reasons why they wouldn't vaccinate their children. And I think this is important conversation. It's important in the context of vaccine hesitancy that I know we've had a host of really wonderful grand rounds and focused conversations about. And our active duty service members are no different than the general population as far as some of those issues of mistrust and concern about the effects of the vaccine on their kids. And it is incumbent upon us, as we well know in our clinical practice about promoting the importance of vaccines, that this subset of families and children are equally deserving of our attention when we talk about the importance of vaccinating our family members and our children as a way out and a way forward and a way out of this pandemic. So, talked about some some of the downsides, some of the social determinants of health adversely that affect our kids in the context of deployments. But all is not lost, and I want to spend these last kind of third of the talk talking about how well kids do and how and the very large number of services that we can offer to children and families that can be very successful in supporting them through these challenges of relocations and of deployments. And it is in fact true that most children and families, they do well. Kids have a strong sense of self. They become very comfortable with the unfamiliar. They actually have higher and stronger bonds and relationships with their parents and siblings as a product of their military experience, and develop a really strong sense of community and network support. The target, the really special target, and I think important target in where we find success is with resilience, is with combating stress, and with improving family functioning. And certainly these are successful strategies that not only apply to military connected children, but to our civilian kids and families as well. But the host of services that the military provides really focuses on those three aspects of success: resilience, combating stress, and improving family functioning. And that's the second take-home message that I really want you all to take from today's conversation, is that is really what these services are targeting in their support of children and families. And so first and foremost, I think it is a very special right that's afforded to families and kids, is they get free and open access to healthcare. Military healthcare is top rate, it is top notch, and can absolutely provide families with a stress-free free healthcare service that includes behavioral health embedded in primary care. It includes school-based healthcare services that can be quite extensive and supportive. There are services called the Family Advocacy Program that are critical to supporting families, in particular families at risk in the context of maltreatment. There's something called the New Parent Support Group, which is a wonderful service for families that have a newborn child, recognizing the unique stressors that affords families. The Chaplain Corps is a robust service of support within the military. And then there's a few of these other programs that I'm going to spend a little bit of time talking about. One is the Focus Project. Two is Sesame Street and their partnership with the military, Military One Source, and Military Kids Connect. So let's talk about the Focus Project. So it's families overcoming under stress. This is a prospective support for military families. It is unfortunately not offered everywhere, but it's at 29 different active duty facilities, 2 within the Northwest. You can see there, one at Joint Base Lewis McChord and another at Navy Air Station Whidbey Island. And it is a prospective family, as I said, family-focused service to aid families in their approach to developing resiliency, developing strong family bonds, sense of community, and helping families and children in particular through whatever challenging aspect they may encounter, whether that be a deployment, whether that be relationship challenges, whether that be movements and maladaptions to relocations. The Focus Project is very highly successful and is a wonderful resource. Sesame Street. Sesame Street first partnered with the military in 2006 to help kids with stressors in military life. Since that time, they have blossomed and expanded their scope of work with the military in a way that is just truly dramatic. And as you can see on the side, this is a snapshot from the website. Sesame Street has created a whole host of educational and interactive, now all web-based services to help family members and kids through the challenges of deployments, family health, grief. And in fact, the grief section is one of the most special and I think valuable components of this partnership. Injuries, military homecomings, and it is at the level, as Sesame Street always does and does so well. It's at the level of the kid, but it's also wonderful and supportive for the family. And I'll just briefly take a moment. I think one of the most rewarding and special aspects of my career in the military was my opportunity to work with Sesame Street, and to be an expert that had the opportunity to review some of their content and provide them some feedback from the perspective of a senior military pediatrician. And I cherish that opportunity, and I want you all to know that this is a resource that's available for your military connected children, but also for your civilians as well. And interestingly, the section on grief, as has been shared with me, it's also in Spanish, has been accessed at a disproportionately greater number than Spanish-speaking active duty servicemen and women and families. And the thought is that it's actually being utilized by civilians and civilian families to support them through times of grief. If you get a moment, navigate to the website. The little vignettes are wonderful, as Sesame Street is so masterful at doing, in speaking and connecting to kids and families about how to talk about traumatic episodes in their lives, how to work through those. And this is a wonderful resource, and it's something that I certainly am proud to talk about and really give Sesame Street an enormous amount of credit for. Military Kids Connect. So Military Kids Connect is an online service for teens, preteens. It has a wonderful breadth of information, of safe areas for chat, for kids to talk about their health and wellness, to talk about their feelings, to talk about relationships, and is I highly recommend it. My kids go to it, my kids navigate to it, and I know many families have as well. They're constantly updating their content. Their content is really developed with developmentalists, with psychologists and psychiatrists, as well as social workers. So it really is a website that is sophisticated and in how it approaches the needs of military kids. It's families as well are engaged and provide expert content, and it's a wonderful resource, and one that if you're not aware of, again, you can refer your families to, and something that you can take a look at as well. Military One Source. So I'm going to pause and talk a little bit about the gentleman here, Dr. Ken Ginsberg. So for those of you who don't know Dr. Ginsberg, he is an adolescent medicine provider who is located at the Children's Hospital of Philadelphia. I view him as a great friend and a mentor of mine when I was at Penn as a medical student. He blew me away in a talk. I was a first-year medical student, and I went and found him, and I said, "Hey, Dr. Ken, I want to be a pediatrician. I love how you talk to students." He is an enormous expert on resiliency, and he befriended me, mentored me, and has been a partner with the military for over 2 decades. He is an expert, as I said, in at-risk youth, but he talks wonderfully about resilience. He's written extensively on this and is connected with the military, in particular in the month of the military child, and in fact has a talk tomorrow. It is a web-based, it's a webinar. Anyone can access it through Military One Source, and he has 2 additional talks throughout the month of April. And if you want to be blown away, if you've never heard Dr. Ginsberg speak, I highly recommend it. He has wonderful tools and resources for parenting, but also has wonderful tools and resources for the kids that we care for. And so I highly recommend him. I think I hold him in the highest regard, and he's a great resource. But the avenue is through this online website called Military One Source. And Military One Source really provides information, answers, support to active duty service members and military connected families, from counseling to financial services to transitions, both movements, but also transitions to retirement, to benefits, childcare, and it's a website that it connects service members and families to real people. for counseling, for advice, and it's a really important resource for our families. I use Dr. Ginsburg as a dovetail into this important aspect of joining forces. So in 2010, Michelle Obama and former Second Lady, Dr. Jill Biden, created the Joining Forces Initiative. And this Joining Forces Initiative was really a challenge to integrate resources from both military and civilian communities to support military kids and families. And it was just resurrected. So just last month, President Biden wrote a letter from the White House promoting the month of the military child in April, but then also talking about the renewed focus on the Joining Voices Initiative that now First Lady Dr. Jill Biden will be heading up. And I'm really excited and I'm really happy about that, because this partnership of both medically but also non-medical partnerships to help military kids and families is so important. As I alluded to, 50% of medical care that military-connected kids receive is in the civilian sector. And some military-connected kids will never set foot in an active duty military healthcare facility. And all of their care is provided by civilians. And if we don't know that, we can't appropriately ask questions and address some of those unique healthcare issues that the social determinants of deployment and movements may impact. But beyond that as well, this partnership between, and the three bases you see there, this is Madigan, this is Bremerton, or Naval Hospital Bremerton, and then Oak Harbor up in Whidbey Island, here locally, are so critical to ensure that we're providing the best possible care for our kids. And I want to thank both Children's, but also Mary Bridge. Mary Bridge, and some of that, their proximity to Madigan. Well, Mary Bridge has been very progressive and very important partners in the care of military kids. And so I thank them, but I also thank the work that Seattle Children's is doing in their partnership with our shared care of patients, our collective training of military physicians, where we send our residents to Children's for their part of their educational experience, where we send our residents to Mary Bridge as part of their educational experience. And conversely, Madigan is a site where University of Washington School of Medicines come and spend rotations with us. And so I think both it's a bidirectional symbiotic relationship and partnership that is so important and is so valuable. And I look forward to ongoing joint initiatives so that we collectively improve the overall health and well-being of this unique patient population. I'll lastly just share with you, in case, I think one of the challenges that I'll pose, and one of the asks that I'll make of you all in the audience is how do you identify kids that are military connected in your clinical practice? Within the active duty service, we know because the only kids that can get care are military connected. But you may not know, short of knowing what their insurance was, if a child walks into your office and is seeking care, whether you're a specialist or a primary care provider. And this is just one example of a tool that originated with the American Academy of Nursing in 2013. Have you ever served in the military campaign? It's morphed into this I Serve Too campaign, and is a resource for providers to not only ask the question, are you connected to the military in some way, shape, or form, but arm you with resources, many of which I've already just shared, in your support of those kids and those family members. And though this is copyrighted, this is not proprietary, they very much encourage healthcare providers to utilize this pocket reference as a way to identify kids and support them who are connected through the military. And so in conclusion, I'd like to highlight a few things. First of all, there is a strategic importance for caring for military children and families. we as military pediatricians and as former military pediatricians recognize that. And we use that argument all the time to talk about why military pediatrics is so fundamentally important, because there is a strategic value to the work that we do. And that is because servicemen and women, when they know their kids are healthy, their most precious commodity is healthy, they can focus on their jobs, which is preparing to and fighting in our nation's wars. More importantly, we want to identify and support military-connected kids who need our help, because we know that a subset of those kids are at risk. They're at risk for mental health challenges, for developmental challenges, and things that can derail their path forward to a healthy, successful, productive life. And much like Operation Pied Piper, sadly, I think we will see for decades to come the lasting effects of 2 decades of war on our military-connected children. And there's much that we don't know. There's much research that needs to continue to take place as we look at these effects. We all recognize the epidemic of behavioral health within our teenage population, civilian or military connected. And I fear and I worry in this under-resourced section of healthcare that these kids so greatly need, that these effects of deployments, of recurrent deployments, of injuries on parents, hidden injuries in particular, will continue to affect our kids and a large swaths of our children. And that identification and that resources promoting resilience, combating stress, improving family functioning, they're out there, they're critical, and they're available. We just need to make sure that we're aware of them and that we can help our families navigate to them. And recognizing too that they may be more challenging for our Reserve and National Guard families. And lastly, part of why I decided to join Children's was because of the partnership and the relationship that I had, in particular with the Heart Center as a cardiologist, but with other members of the Children's faculty when I was on active duty at Madigan. That partnership was special to me. I saw the value that Children's placed on military-connected kids, and I wanted to be part of that in this second chapter of my career. There are a wonderful number of pediatricians, both active duty and DoD pediatricians themselves, especially locally and beyond, that are always willing to partner and educate and provide and develop that symbiotic relationship that's so crucial in our advocacy for children. And I look forward to doing more in joining forces together. Here's some educational references that I encourage people to navigate to. The AAP put out a policy statement in 2019 about how to care for military-connected children. There's a wonderful host of essays published by Princeton and the Brookings Institute about the future of children and military-connected children, in particular in 2013. These are some websites. There's the Uniformed Services West chapter of the AAP, and that's my email address. And please feel free to email me if you have specific questions or concerns. I'd like to thank my crew down at Madigan, Team Pediatrics down there, for their support and for their hard, worthwhile work. I'd like to thank the veterans within our Children's Network. I know there are many. I'd like to thank Captain Greg Gorman. He is a pediatric nephrologist and a senior executive within the Defense Health Agency, who provided me with some guidance on this. And lastly, I'd like to thank Teresa Vu, who provided me with some data from Children's. On that note, I'll take a few minutes. I think we have a few minutes for questions. Thank you.
Thank you so much. Thanks, Dr. Studer, and thank you for your service and for teaching us about this really important topic. Everyone who's on this call, remember that you can submit your questions via the chat function at the bottom of your screen. We have about 6 minutes for questions. In the meantime, I'll ask a question from Rob Mazer. How does the military consider child health and mental health when considering military assignment or deployment? And this is regarding general child well-being, but then also specialty services.
Yes, an important question. So I didn't talk about the Exceptional Family Member Program, but the Exceptional Family Member Program is a program that is a Department of Defense program that and it mandates that dependents, children or spouses of active duty service members, that that their unique specialty healthcare needs are documented and play a role in where active duty service members are assigned. And the requirement is that there has to be services, healthcare services, that meets the needs of those children or spouse within a 60-mile radius, and that sometimes varies a bit. And it doesn't have to be military healthcare services, it can be civilian as well. And so for children that have significant behavioral health care needs, those future assignments for active duty service members have to be at a location where those services are available. You can see how that can be an enormous challenge. Within the Northwest, because of the scope of both services at Madigan, but also at Children's, there are almost no disqualifying conditions that would prevent a service member from being assigned to this area. Historically, there has been one, and it has been behavioral health. Interestingly, that there was a period of time, and this is changing, but the needs of kids that had teenage in particular of behavioral health challenges just weren't available, in particular in Pierce County, such that some of those service members were denied a transfer to this location and had to be moved somewhere else. Autism was another one. Autism services were woefully inadequate originally. That has since changed with the CARE Center, the Center for Autism Resources and Educational Services, that has been wonderfully and widely successful at Madigan, that has allowed now more service members to be stationed here. But to the point and to your question, we would never, the Department of Defense would never allow a service member to be transferred to a location where healthcare services weren't available for those service members. Now that comes with an asterisk. They may send the service member, if they're needed, to a location unaccompanied and not allow the family to join them. And you can see how that can create a host of challenges and problems. But there is a system in place. It's called the Exceptional Family Member Program that is intentionally created to ensure that when service members are moved and they have a child with special healthcare needs, they're moved to a location where those needs can be met.
Thank you. And then a question from Bernie Bernstein. What DoD policy changes would you advocate for based on this data to improve military children's wellness?
I think one of the challenges that we've seen in the last few years is the military healthcare system has really gone through a major evolution. And it's now all the services follow what's called the Defense Health Agency. And that was a mandate from Congress in 2017 that there wouldn't be a disparate amount of care or differences in the way that an Air Force facility or an Army facility or Navy facility provided health care. And they unified all of that care under what's called the Defense Health Agency. As part of this transition, I think one of the struggles has been, from an identity standpoint, is what's the investment that the Defense Health Agency is going to have in the medical care for dependents, and should it be completely civilianized? I think they've walked back from that, but as a product of this transition, we've seen a significant decrease in the number of and I'd say commitment from the military side to behavioral health assets for kids. There's something called CAFBIZ. It's the Center for Child and Family Behavioral Health that has unique specialty services for kids, and that sadly has been gutted. We have lost a lot of healthcare members that provide a real critical behavioral healthcare assets for kids, and that has gone away. And I think that a renewed focus, a renewed commitment, both monetarily as well as by actions, to behavioral health assets for kids is probably one of the most important things I think that DoD can do.
Yeah, great point. Thank you so much. Perfect timing. It is 8:59. So again, I want to take this last minute to thank you, Dr. Studer, for all the work that you've done and for bringing this important topic to light for us, and especially for coming to Seattle Children's after all your time in the military. So we really, really appreciate you. Thanks to our audience for being here, and we'll see everyone next week. Have a great Thursday. Thanks again.
Thank you. Thanks, everyone. Enjoy the rest of your day. I appreciate your time.